Hi, we're trying again from a different device. It might be my device that's the problem. My husband even asked me that, and I was like, I've done a live video on this before, but I've never added anyone in on the live video on my iPad, so we're going to try it on my phone, which just means I have to actually hold my phone, which is going to be kind of annoying, but I'll get over it. So we will try this, and again, Helen keeps disappearing every time I try to see who that is. There she is, guys! We're gonna get to talk to Helen. Apparently it was my device. I'm sorry. Now I know for the rest of them. I have to do it on my phone, even though Google said I could do it on my iPad. So give me a second. I'm gonna add Helen in, and we're gonna start chatting.
Hi.
Well, that was fun, huh?
I know, that was quite the experience.
I'm so sorry.
It's okay. I'm glad we figured it out in the end.
Right? And ultimately, I'm glad you're not here, so you're not going to get sick from us.
There you go. Yeah, I appreciate the thought.
Yeah. So, good morning.
Good morning. It's great to see you. Thank you for having me.
I'm so excited that we get to chat today. I'm a little
Me
sad I don't
too.
get to see you in person again, but soon.
Yes,
Good.
absolutely.
I'm going to be drinking a lot of water and coffee probably today, just because I still got a
It is
little...
that time of day.
Yeah. So, awesome. Well, Helen, we've wasted so much time with my ridiculousness. I just want to try to tell us who you are. Like, where are you from? What do you like to do? All that kind of stuff. Who are you?
Yeah, so to begin with, my profession is really like a huge passion of mine. So I am a licensed massage therapist, and I specialize in women's health, so pregnancy, postpartum, all sorts of various different like pelvic and reproductive disorders. So that's definitely like a huge facet of who I am. I'm constantly like learning, and I'm kind of just like obsessed with what I do, which is I think a good thing. But aside from that, I live locally. I live right in Shrewsbury. There's lots of things I love to do. I'm a very crafty person. I love cooking, snowboarding in this weather. So lots of different stuff. Yeah. Rhiannon, I think, can you see me still?
Oh no.
Well, I used to have a jewelry business before I became a massage therapist. So I was selling on Etsy. So I make a lot of, or used to make a lot of like earrings and various different things like that. But I've always been very like artistically inclined, I guess, ever since a little kid. So me and my dad used to draw together all the time and stuff. I come from a family of architects, so I guess it's kind of in my blood a little bit. But
That's so
yeah,
fun.
yeah.
Are you wearing any jewelry you made right now?
No, I kind of had to stop making jewelry when I became a massage therapist because it was kind of messing with my wrist. So I had to choose one thing or the other, which is unfortunate, but I still dabble from time to time, but I can't make it like I used to. So, but that's okay.
Nice. Well, talk to me about being a massage therapist. You own your own business,
hmm
and like, I guess maybe tell me like, how did you get into that? Like, what piqued your interest in it, and specifically with women's health? And
Yeah.
tell me a little bit about like where you're at with that right now.
Yes, totally. So, my story begins probably like 7 years ago, actually, when I went to school. I went to college at UMass Amherst, and I grew up kind of right outside of Boston, and I was never really alternative medicine, I guess, as a child. Just living in Boston, there's so many big hospitals and all that stuff. It's just not like something that was at really the forefront when I was growing up, I guess. And then I went out to Western Mass, and it's like boom, right kind of in your face out there. And I actually, when I was at school there, I started taking a bunch of herbalism classes. Me and a friend of mine kind of got into it together. And UMass is really cool in that they offer like a lot of different types of like alternative medicine and herbalism classes and stuff like that. So we kind of just like played around with that for a little bit, and we lived together, so we would kind of just like be little witches in our kitchen and make these like cool concoctions and stuff like that. So I kind of started getting into herbalism when I was out there, and just the whole world of alternative medicine. And it was actually one course in particular that kind of like opened my eyes and changed my life. And that was called Herbal Approaches to Women's Health. And so we kind of just like, it was a beautiful group of women, and we just learned all about our bodies and how to take care of them naturally, as opposed to kind of like, all the regular types of treatments, which,
Right.
in my opinion, aren't always the best. And it was in that class, I think I was 19 years old when I was taking it, and I realized just how little I knew about my own body, which was really, really crazy to me, and it was super eye-opening. So that kind of really sparked my interest in women's health, and it was in that class where I learned about like, natural fertility, natural pregnancy, all sorts of different things like that. And I guess that also sparked my interest in kind of like pregnancy and childbirth and postpartum as well, because they actually had a midwife come into that class out who practices, or I don't know if she still practices, but maybe. So she came in and she talked to us, and she actually had a home video of her birthing her own child unassisted.
What?
She lived out, yeah, she lived out in the hill towns of like Western Massachusetts, and I guess there was a big snowstorm that happened, which many midwives tell you there's, babies will come when it snows. But there was a big snowstorm that happened, and she, the midwives that were supposed to be attending her birth actually weren't able to make it there in time. So thankfully she was herself a midwife, but she filmed her like just birthing her own
Wow.
baby, and it was the most incredible video. Like all of us were just crying because we had just never seen anything like that before. She was so calm and collected, whereas in the media you always see like screaming women, like in just like the worst pain ever. It's just this crazy, dangerous, terrible experience, according to what I believed even prior to that. Yeah, according to Hollywood, and just pretty much everybody. Even my mom told me it was like the absolute worst thing that you'll ever go through in real life. So it's kind of this thing that's like instilled in society, and this video just kind of was like a total shift for me, and I was like just amazed by it. And it was from then on that I just became super fascinated with pregnancy and childbirth, and just like, how can we create this beautiful experience for more women around the country and the world even. So how can we kind of like create a new paradigm for women and women's health? So Wild Moon kind of has come out of that. I went to massage school. I was actually a French major at UMass randomly, French and linguistics. Yeah, so I kind of did like a total shift. So that class left a huge impression on me. And that was actually where I learned about Maya abdominal therapy, or Vigo techniques of Maya abdominal therapy, which is another form of body work that I practice. And so that was kind of like at the back of my mind throughout the rest of my college career. And after that, after I graduated, I was just like, you know what, I need to pursue this because this is what I feel really called to do. So so that's kind of how I got here. And after graduating massage school, I worked at a couple other places while I kind of just like got some experience and everything, and was pursuing all of my kind of more advanced certifications in women's health and stuff like that. But now I'm just so happy to be able to have my own practice and be able to just have creative control and do really and devote it to like what I love and what I'm passionate about. So yeah.
Awesome. I love that that's how you began. It wasn't like, oh, I love to do massage, or like whatever. It was, I'm passionate about women and like understanding ourselves and like being more holistic, and like that's awesome.
Yeah.
I'm just
Definitely.
I'm like getting into, so I've been sick for the last however many days. It seems like forever because that's how things are when you're sick. But I've had really swollen lymph nodes, and instead of going to the doctor and just automatically getting an antibiotic, I'm like, okay, let's see, like, can I deal with this myself? Because you're right. Like, I feel like it's our automatic response is just to go, oh, let me just put a patch on it and like not deal with
Yeah,
like figure out ways that we can treat things naturally. So like it's getting better.
definitely.
My jawline has gone down. Like I feel like I have a jawline again. Earlier this
Well,
week.
that's good.
So
Yeah, and
anyway,
that's
that's
a big thing I
awesome.
think too for thank you. Yeah, that's a big thing I think too for women is like really learning to be able to trust our bodies as opposed to like seek external ways to kind of like control it. Like our bodies are so, even when you're just sick, our bodies are so equipped to deal with like bugs and things like that. We just sometimes it's a little bit of a waiting game and it's uncomfortable, but we are so capable of doing that ourselves instead of just like hammering things with antibiotics and stuff like
Right.
that. So it's good. I'm glad that you had that experience. Well,
Right?
not
No,
that you're
I'm like,
sick, but
right? I know.
yeah.
Hey, thanks. um, so a couple of things you said kind of piqued my interest. But before I jump into these other things, I want you to just quickly talk me through. You offer several different. I was looking at your website the other day. See me, and you offer several different types of massage. Like I think you just offer like regular type massage, like therapeutic massage. You offer the Maya abdominal type massages you're talking about, all those kinds of things. Can you kind of like tell me like what are the different things that you offer? And yeah.
Sure, yeah, I can do a little walkthrough. So yes, I do offer just what I call custom therapeutic massage, which is, what I learned in massage school and is really amazing if you're having, like chronic pain or you injured yourself or you're just stressed out. Definitely coming in and getting like a therapeutic. So most people know that as like Swedish or deep tissue. Those are the kind of common buzzwords, but I don't like to kind of like limit it to just that because I really try and treat people as an individual. So I don't want to like just block you off. Oh, you're getting a deep tissue massage, you're getting a Swedish massage. I want to be adaptable and be able to treat somebody in the way that they need to be treated. So that's kind of what I call a custom therapeutic massage. So we really just like listen to what's going on with you and kind of like work together to create a treatment that would be most beneficial for you.
I want
And
you to be
then
my
I
doctor in every area of life. Like that's what I want
well,
from every care provider I could ever have. Anyway, continue.
yeah, yeah, no, well, that's so true because that's what I love about what I do as well because I actually get to spend like, an hour plus with people individually and where like obviously you need to go to the doctor but like what do they spend like 5 to 15 minutes with you and that's going to be like that's addressing
Right.
everything that you need to have done. I think it takes a lot more time than that. So
Yeah.
so I really try and like get to the bottom of what's going on with people. So aside from that, I also offer prenatal and postpartum massage. So I absolutely love helping women through, the process of pregnancy and then after they give birth, postpartum as well. So, prenatal massage, I feel like so many people think of it kind of as just like, oh, relax treatment. And it is, very relaxing. A lot of women say like my table is one of the only places that they're really comfortable by the end of their pregnancy, which is like really nice. I think it's good feedback, but I also really focus on preparing women's bodies for the huge effort that is childbirth. A lot of people don't really like realize that you really do need to release the soft tissues in the body. So like the fascia, the muscle, the ligaments, like everything needs to be nice and relaxed and released in order to allow like the pelvis to move in the way that it needs to move when you're having your baby. So like restrictions and things like that are kind of like in the pelvis and they might have preceded the pregnancy or they might have come up during the pregnancy or pelvic imbalances, things like that can actually have a pretty large effect on like the outcome of childbirth. And also receiving regular prenatal massage, especially in the third trimester, a lot of the time will reduce the pain that women experience during labor, which is, yeah, there's been studies done on it. It's actually really, really that's yeah. I love telling people that because they're like sign me up. But so yeah, so there's like just so many. It's just so good for your health to receive massage during pregnancy, and it's not just like a frou frou like you know, I'll just like rub your back a little bit, massage. Like I love getting in there and really like helping women relieve pain and prepare their body and everything like that. So, and then in postpartum, you know, nurturing touch is really such an important part of postpartum, which can be a really, really tough time for a lot of women. It's very stressful and anxiety provoking. Just making that huge adjustment. So I love supporting women through that, like on a kind of like energetic and emotional level. And then also, you know, you just went through a huge physical effort and your body needs recovery time. I feel like a lot of people think that their body will just bounce back and they'll be able to go do whatever, you know, like a week or two after they give birth. And that's, I mean, unfortunately, just not really how it works. So I like being able to help women's bodies heal quicker. We can address any like issues that have come up, you know, prenatally or during childbirth. And, you know, so a lot of the time we'll do pelvic work, we'll do abdominal work and help like, you know, the uterus heal and everything. A lot of the time women will have a lot of back issues from breastfeeding so much. Picking up the baby creates like a lot of arm issues, low back issues, so all sorts of different things. And I really enjoy having that like specific knowledge and being able to help the postpartum body in the way that I do. So, and then the final thing that I offer at the moment is the Maya abdominal therapy. So the Arvigo techniques of Maya abdominal therapy is the full name. And it's a really, really beautiful form of body work. Actually, it's originates from Belize. It was kind of passed down from the Maya shamans and mixed in with more modern forms of body work and, you know, approaches to anatomy and physiology and stuff like that. So it's a lot of abdominal work, pelvic work, low back work, and really what we try and do in those sessions is address, you know, various different types of like pelvic imbalances. A lot of people will come to me with like reproductive issues. So I see a lot of people for fertility struggles. I see a lot of people for like menstrual disorders, like really painful periods, heavy periods, endometriosis, polycystic ovarian syndrome, like kind of, it really runs the gamut, prolapse, you know, incontinence, stuff like that as well, which is, you know, a lot of these things so many women suffer from, and we kind of suffer in silence a lot of the time. So I love creating a space where women. What's that?
There are things like you don't want to tell anyone, like, oh,
yeah,
I suffered from incontinence because I had 4 babies or whatever, you know, like.
Right, but the statistics are I mean, I think something like 50% of women are still struggling with incontinence 18 months after giving birth. So it's like, it's not like it's uncommon or anything like that. And in fact, like a lot of women don't realize it, but like the levels of incontinence that are happening are usually, they peak around 7 years after having your children.
What?
So yeah, so so it's like you really want to practice preventative medicine and not just like address things when the symptoms come up. So that's like another big thing. So I'm kind of like trying to tell women, you know, really get in front of all this stuff, take care of your body. There's really simple, beautiful things that you can do to kind of just like not only prevent these things from happening, but also address them if they've already come up. So yeah, and then, you know, the Arvigo therapy is also really good for digestive issues and, you know, all sorts of good stuff. So yeah.
So I actually went through infertility before my first. I have 3 beautiful children now. But with our first, we had undiagnosed infertility, which is about 20% of infertility diagnosis, which is super frustrating because you're like, I just felt like
what's going on?
Right, like there's got to be a reason and you can't find it. Like, what's the problem? So like for somebody like me that has like an undiagnosed, instead of like something like endometriosis or polycystic ovary syndrome or whatever, for somebody like me, like how would this therapy, like talk me through what a session would look like, or like a treatment plan, I guess, because it might not be just one session, it could be more.
Yeah,
like,
no,
I don't know.
It's usually quite a bit more than one session, but so I mean, again, it's kind of like the custom therapeutic work that I do. It's very, very individualized because everybody is so unique, and especially when it comes to fertility, there's so many different factors, as I'm sure you're aware, that go into it. So, you know, one of the things, so in the initial sessions for my abdominal therapy are actually 2 hours long. And the reason that I do that is because I spend between like 30 minutes and 45 minutes at the beginning of the session, like really getting to know you and getting to know your lifestyle and your history and everything. You know, we go back like to menarche and we talk about your menstrual cycle, we talk about your diet, your stress levels, your sleep, like everything. And you know, that's something that a lot of like reproductive endocrinologists don't like spend the
Right.
time really doing. They'd
Nope.
rather just like pump you full of hormones. And what's that?
I said I barely talk to my reproductive endocrinologist. They like, he talked to
Yeah,
me less than an hour total, like the whole treatment, and I saw nurses who drew my blood. Like that
right,
was my
exactly.
relationship with him.
Exactly. Yeah, so it's I mean it's totally mind-boggling that they don't kind of like, I mean I know that they're pressed for time obviously, but you really do need to spend that time like getting to know somebody and know their body. And like, you know, I'll have people start fertility charting so we can keep track of their hormones and do all of the, you know, instead of like getting a blood draw, we're going to see exactly where your hormones might be a little bit wonky and if you're ovulating and like when you're ovulating and all these different things. So I really try and like create a collaborative process with women while we're working on this stuff. So anyway, so we do the intake, which is, you know, like up to 45 minutes, I would say, depending on how complex the issue is. And then we do the hands-on session. So a lot of the work for my abdominal therapy is actually around the uterus and the ovaries. So I actually do like go in and I kind of like feel for the position of your uterus. A lot of women don't realize it, but the uterus can be kind of like tipped forward, tipped to the side, tipped backwards. And that actually can create kind of a lot of various different reproductive issues when, like, you know, blood flow can't get to the uterus adequately, you know, nerve impulse gets affected, lymphatic flow gets affected. So really what we do is actually like reposition the uterus. And a lot of times when it is out of position, and people will see a huge amount of uh, good results from that. But we're also just like really stimulating blood flow, which helps to get like hormone levels balanced out and hormones pumping through your reproductive system and gets that good, like, you know, oxygen rich blood to the uterus. It reduces inflammation. If there's any scar tissue, we can start breaking down scar tissue. So like people who've had cesarean births and stuff like that, or endometriosis, any sort of like inflammatory issue, we can start to kind of like break that down and restore balance to the pelvis. So yeah, a lot of the time it's really fascinating because like this physical component to fertility, which is a very physical process. I mean, getting pregnant is in nature, it's a physical process, you know. People don't really address it. And it's fascinating to me because like, you know, people will do like Clomid charges or they'll do all these various different things. And you're still, if you have congestion in your pelvis, if you have a tilted uterus, if you have anything going on, an imbalance in your pelvic bones, like your reproductive system is not going to function in the way that it should be functioning. So that's really what I try and address in my sessions. And then we also look at other aspects of life too. But yeah.
Wow. I wish I would have known you 5 years ago. Like
Yeah,
that's
yeah.
such a different way of looking at life. And like we were very lucky. We had one try of IUI, you know, and we got our beautiful daughter who's right
Oh, that's
behind me.
awesome.
So
Aw.
um but yeah, like it's not fun being poked and prodded with needles all the
No.
time. And like
Yeah,
since I got pregnant with her too, like I've started seeing a chiropractor, which is so much better, and like, you know, learning about how, and
definitely.
I'm going to be interviewing him in February if anyone's interested, but like just, you know, how everything needs to align. And I had no issues getting pregnant after after
That's
that.
awesome.
And I I think partly I think him, you know, just keeping me well aligned and,
Totally. Yeah.
you know, whatever. Anyway, awesome. Let's talk about prenatal massage. So this is probably a silly question. Do you lay on your belly? Do you have a table
So
where you can lay on your belly during a prenatal massage?
Yeah, so I don't. I have women inside lying, so on your side. But I do have a system, like it's a side lying bolster system, which is extremely, extremely comfortable. Like I said, like most women tell me that my table is like one of the only places they can actually get comfortable by the end of their pregnancy.
Uh-huh.
So I really make a lot of effort to make women feel as comfortable as possible. I'm very like stringent about, oh, your leg needs to be at 90 degrees, from your pelvis so that you don't have like any compression or anything, so I think of everything. It's really
Mhm.
important to me to make women as comfortable as possible.
Right.
And also, to be honest with you, I'm not a huge fan of the lying face down tables.
Huh.
Because they I know it can be really like nice by the end of pregnancy to lie face down, but like they're not made for every single body. So like for a lot of women, it can be kind of uncomfortable because you have that weird like belly cutout, and if somebody's shorter than another person, and somebody's tall, it just doesn't line up properly. And then also where I do so much uterine work, like outside of pregnancy and during pregnancy as well. I also just wonder about the integrity of the ligaments that hold the uterus in place, because they're already strained when your belly's growing. So I don't want to put like a ton of additional strain on it by having somebody lie face down for like an hour and a half
Right.
during pregnancy as well. So yeah, that's my viewpoint on it. If I can do it inside lying comfortably, then I'm gonna do it.
I was saying before, like I had one massage when I've been pregnant, but it was
Mhm.
like on a family vacation in like Dominican Republic, I think. So it was like at this resort, like they're not used to seeing pregnant women. I was in my first trimester, like I should have been able to lay on my stomach anyway, but they were
Yeah,
like insistent, like
really,
you,
to have you on
and it
your
was
side.
so uncomfortable because like they just were not a good masseuse anyway, but it was just so uncomfortable the way that they had me,
Yeah.
and it's not good. And I was like, oh, this is awful, and I couldn't
Oh
imagine doing
no.
having to do in my third trimester. It would have been even worse. So
Yeah.
that's again, I wish I would have known you then.
I know that's the it like upsets me so much when I hear people tell like horror stories about prenatal massage, because like there's actually a lot of therapists that will just do it without having proper training in it, and like you really like I've like probably at this point over like 70 hours of training in prenatal massage, with continuing education. So like if you consider that like a therapist who has like zero training and maybe like an hour or two in school or something of prenatal massage training, then that's absolutely bonkers. And no, you're not going to be comfortable, and they won't know the safety precautions, and they won't understand how the pregnant body works and what needs to be worked on. So you really need to come to somebody who specializes in it, like I do. That's like it's totally mind blowing to me that people even feel comfortable doing prenatal massage when they're not trained in it. And
Right.
that's when you kind of hear about these horror stories of people, like I've heard people talk about like, their therapist was like afraid to touch them, or they couldn't massage their feet or something like that because they thought they were going to put the woman into labor or something. It's like, no, you're not, they're not like gonna break if you do a deep tissue
Right.
massage on a pregnant woman. It's just they're pregnant.
Yeah.
So I kind of, I would love to be able to see a world where pregnancy massage is more, uh, is better. There's more kind of like regulation and training that needs to be done.
Right.
So, yeah.
So let's be real. Okay. 3 pregnancies. Your end of your pregnancy, you're just so uncomfortable.
Yeah.
You're looking for like one of my closest friends is she's like 39 and a half weeks pregnant right now, and she's like, I just want this baby to come, and I know that feeling. Like I've been there.
Mm-hmm.
If somebody came to you and was
Mm-hmm.
like 39 and a half, 40 weeks pregnant and was like, can you induce labor? Is that a real possibility? Like with a massage?
So your body's gonna begin that process when it's ready to begin that process. And I don't say that massage like indefinitely does or doesn't
Mhm.
like jumpstart labor. But I will say that there is a lot to be said about you know, at that point, like you're saying, you're so uncomfortable and you're kind of like stressed out about the impending, like, when is this going to happen? Da, 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 da. So like your body kind of goes into this like parasympathetic stress state a little bit. And anybody who knows anything about birth knows that when your body is in this this state, this stress state, like it's not gonna feel as comfortable giving beginning the process of labor. So when we can get women on the table and get them feeling really comfortable and like they can relax and just let go, and we get that oxytocin and endorphins and all these good hormones flowing around the body, a lot of the time, you know, I won't say that it happens every time, but a lot of the time I've, you know, had women who are at that point in their pregnancy and they come in and they'll get a massage and then they'll go into labor like that night or the next day. I've definitely had that happen quite a few times.
But more
so yeah,
like hormones, not necessarily like a pressure point, which you know, you
no, I don't do any pressure points. So the pressure points are funny because like so many people think like at any point in your pregnancy, if you push this one pressure point like somewhere on your foot or your ankle or something like that, it's gonna just like shoot you into labor, and that's like not true at all. You know, you shouldn't be scared to get a foot massage during pregnancy because of that. The thing is, if you're already in active labor, there is evidence that if you start pressing these points and stuff like that, then that can help progress it. But you're not going to go into labor because you press these points if you're like in your second trimester or something like that. So,
all right, ladies, you heard it from her. Tell your husbands. That's what yes. I just heard. Give me a foot massage.
Yes, you can. Awesome. I give you the ability to have a foot massage. Yes.
So I was just telling you, I have this friend who's about to have a baby any day, and she wanted me to ask you about postnatal. Like, is that what you call it?
Postpartum. Yeah, postpartum, postnatal. Yeah.
I was like, that doesn't sound right. Postpartum massage. When is an appropriate time to start getting massages after delivery?
So really, I mean, anytime you feel ready. I'd say like it's probably, if you can just like hang out in bed for like at least a week, and not really like get up and walk around, that's probably ideal for kind of like uterine healing and pelvic healing and stuff like that. So but you know, I've had women come in, you know, 1 week, 2 weeks, 3 weeks. I think that that's probably a good time. And the other thing that not many people know is, but I do in-home postpartum visits up to 4 weeks. And if you're on bed rest during pregnancy, I also do in-home visits as well, because I think it's a really important time to be able to be at home, be with your baby, not like be up and moving around too much. Like in a lot of cultures, they make the woman lie down for at least a month and not really move hardly at all, except to take care of the baby. And I think that's, you know, a really good thing, because that facilitates a lot of healing that needs to happen. Like I said before, your body just went through a huge effort, and there is a lot of healing that needs to happen. You shouldn't be up and like doing everything that you were doing, you know, before you got pregnant, you know, a week after postpartum or a week after you have your baby. So yeah, I do in-home visits. And if you wanted a massage like 3 days after you give birth, I'll come to your house and do it, but I don't think you should be coming to me at that point yet. Maybe like 2 or 3 weeks is a good point to be coming to me.
Okay. And what are the benefits of a postpartum massage? I mean, other than like, obviously it feels good.
Yeah, sure.
A little bit, but like, can you maybe talk about that a little bit more? Like the postpartum stage specifically. I'll shut up and let you talk. Go.
Yeah, no, definitely. So there's quite a few, and so it also really depends like where you are in your postpartum journey as well. But something that I really love to do, and it's, of course, I always like leave it up to the woman whether she wants this work done or not, but I do love doing some abdominal work postpartum. If she has not had a C-section, we have to wait a certain amount of time to do that if she's had a C-section. But you know, increasing the speed of the uterine involution, so like helping the uterus go back down to size. A lot of the time women will have like pain in their low back, their hips, various different areas, just from like the huge effort that their body went through. So we're able to kind of get in there and release any like pain or tension that's going on in those areas, and just kind of like facilitate that healing. And like I was talking about too, with the new responsibilities of motherhood, so like breastfeeding is a full-time job. It's, 40 hours a week you're breastfeeding. So a lot of women, their backs, they'll come in and their shoulders will just be like so anteriorly rotated from like holding their baby and like looking down at their baby while breastfeeding. And that's like, I'd say probably one of the biggest things that I see postpartum is just like women are like, oh my, I'm getting migraines now. I've never had migraines before because because their necks are so tight or their shoulders are so tight. And in addition to another really interesting thing that I see in postpartum is when women are picking up their babies or picking up car seats, things like that, during breastfeeding, you actually still have a lot of the hormones that make your joints kind of like more flexible and relaxed. It's called relaxin, is the hormone. So you are kind of still more prone to injury, actually, kind of in the same thing as during pregnancy, which is really fascinating. A lot of people don't realize that. So when you have these women that are like picking up car seats improperly and picking up their babies and then like rotating their pelvis in weird ways, and you are prone to getting a little bit injured in that sense, and it's your body kind of like can shift much more easily than it would otherwise. So I always check alignment and making, we talk about like, how to breastfeed properly, like ergonomically, and how to pick up car seats and how to hold your baby and do all these things so you're not creating these weird imbalances in your body.
Nice.
So it's a lot of stuff.
What about fluid retention, like during pregnancy and postpartum? Does massage,
Yeah.
I assume that's very helpful?
Yep, absolutely. Lymphatic drainage is definitely increased by massage. Lymphatic drainage massage is actually, it's a lot different than like a regular massage. It's very light. It's like kind of featherweight because lymph doesn't move if you actually go too deep on the body. So like a regular deep tissue or like Swedish massage probably won't have that much effect on your lymphatic system. But if you do like a lighter lymphatic drainage massage, it helps a lot with the fluid retention for sure.
Nice. That's awesome.
So,
yeah. And then you were talking a little bit about C-section. So I've actually had all three of mine were C-sections, which I'm very excited about that I never had a chance to try natural delivery. But for somebody like me, how long postpartum, because you said a little bit longer for postpartum massage, and then for even now, it's been 2 years since I had it. You can work on like scarring and like that kind of stuff.
Yep, absolutely. So the only thing that you would need to wait on C-section during postpartum is the abdominal work. Like if you want other areas on your body massage, then that's fine. But we do need to obviously wait for the scar to heal before we can touch it. So it's just abdominal work. I usually wait 6 to 8 weeks to start working over C-section scars just to allow that healing time. And of course, if any infections or complications happen, then we have to account for that as well. But yeah, so actually C-section scars are like one of the biggest things that I really love to educate people about and love to work on, because they can actually have a really big effect on your health going forward. So, a lot of people like kind of don't really realize it, but like when you get a surgical incision in your body, like a C-section is kind of crazy because it cuts through a lot of tissue, like a lot of tissue. And I feel like it's not like really looked at like one of those like huge major surgeries that you have, but it's a major surgery. Yeah, it's huge. You're cutting through organs, you're cutting through like multiple layers of fascia and muscles. So yeah, it has huge implications. So as scars heal, it lays down obviously scar tissue externally, which is what you can see, but then also when you're cutting through organs and fascia and everything internally as well, your body lays down something called abdominal adhesions, which is kind of like, it looks like a web of scar tissue that's inside of you. And a lot of the times it can like bind your organs to each other. It can bind organs to muscle. It can bind organs to bone. It just really kind of like limits the amount of blood flow that's getting to your organs. I've seen people come in with like secondary infertility, with digestive issues, with menstrual issues. And a lot of the time, I believe it's caused by abdominal adhesions. And,
Mhm.
you know, C-sections are kind of funny because so I saw a statistic the other day where they were comparing different types of abdominal surgeries and like the rates of people getting the abdominal adhesions after them. And C-sections were the highest at 90% of people developing abdominal adhesions after C-sections. So, so it's really something that, what's that?
That's my life. Like, I've had 3 C-sections.
That's your,
So,
yeah,
like, there's something I can,
yeah.
like,
So,
use to help me prevent
yeah,
adhesions, or, like,
definitely. The sooner we start working on it, the better. Is so I love like the abdominal work my abdominal therapy is so good for helping to break down the abdominal adhesions. So really, when we start working in there and getting in there and like doing massage on it and, you know, all sorts of other different like complementary things, what we do is we actually change the collagen cross-links in the fibers of the abdominal adhesions. So we make them more regular. We start breaking them down a little bit, making it softer, making blood able to flow a little bit more easily into your like pelvis, essentially, to your organs. Like, organs need movement room in order to function properly. And when you have all of these adhesions that are like binding it to other structures, they're not going to be able to move. They're not going to be able to receive that blood flow that they really need. So yes, so the massage helps to break that down, create more space for movement and room. You know, a lot of the time women will develop like low back and pelvic pain and issues from having the abdominal adhesions because of the fascia. So like basically I can kind of show you on my arm here. So like imagine that like the back of my arm is like the sacrum and the back of my pelvis. When you take the fascia and you cut it and you twist it like that, it'll heal so it's really tight on the front here, and then it'll create a lot of tension all the way around. Right, so you're affecting the back the same amount as you're affecting the front. So really releasing everything in the front helps to help, you know, create more pelvic balance in general. So yeah, no matter where you are in your C-section, I recommend starting work at like 8 weeks if possible. But no matter where you are, if I have people who've had C-sections 20 years ago and they've already experienced relief from a lot of their, like, you know, digestive and back pain symptoms and stuff just through abdominal work.
I can't wait to start coming. Oh my goodness. That would be amazing.
Yeah, it's really important. Yeah.
So I have another question that's kind of not totally off, but like different, that I want to remember to ask you. And that's about what kind of oils you use. So I know massage involves a lot of different oils and whatever, but you seem to be a more holistic kind of approach. And so I'm just wondering, what do you use when you're working on people?
Yeah, so my kind of just like go-to when I'm doing regular, you know, therapeutic massage, or when I'm doing prenatal, postpartum, or just like even my abdominal therapy, I use organic sunflower seed oil, actually. And that, I think it's just like a nice light oil. It absorbs really well into the skin, so you don't leave like a total grease ball, and like, you know, going to work when you're all oily is never fun. So that's what I use typically. For, as we were just talking about, for like scarring and abdominal adhesions and various different things like that, I also use some castor oil sometimes, which is a really helpful oil for kind of like getting in there and promoting lymphatic drainage and blood flow and all these beautiful different things. It's a very healing oil. And also sometimes during sessions, depending on what's going on, I'll also use some essential oil blends that I have too. Yeah, I have one for kind of like to increase blood flow locally and create more hormonal balance. And then I have some others that are more specifically oriented towards scar work as well. So, so yeah, I keep it pretty simple, actually. Usually pretty much 4 oils is what I keep it to.
Okay, nice. And then, so I've seen on your social media pages, on your website, you do something called vaginal steaming. Can you talk to me about that? What is it?
Yes.
And what are the benefits of it?
Yeah. Yeah, so it's actually a really, really amazing practice. And it's used almost all over the world and has been kind of like largely forgotten in Western culture in a lot of ways. So it actually comes like the way that I learned was through pursuing the Maya abdominal therapy work, because in Belize, where that work comes from, in a lot of areas in the Caribbean and everything, they still use vaginal steaming as a regular kind of like healthcare protocol for women, especially after childbirth, but even just normally as well, just for a lot of various different gynecological complaints too. So what it is so I studied herbalism, so I create kind of like a blend of herbs, and then I boil them up, create like a nice kind of like herbal infusion that kind of steams upwards. And then I've made like some seats that you use that have like an opening in the bottom. So basically I just have women sit on the seats, and you put kind of like your vulva right over the steam, and it just kind of like wafts up, and kind of like it's really good for helping to relax the pelvic floor, increase blood flow, warmth, all these good things. And a lot of people who practice vaginal steaming have seen really intense kind of regulations in their menstrual cycles. Their periods get a lot lighter, or can become more stimulated if they're stagnant and light. So it has a lot of various different benefits depending on what you're going through or where you are in your life. So yeah.
All right. That's awesome. I've never heard of
So
it.
It's really nice. Yeah, actually a lot of cultures will have women steam every single day for between like 2 weeks to 30 days after having a baby as well.
Wow.
Because it just facilitates so much healing. Yeah. Yeah, so
Yeah.
it's really cool. It's a lot of people get kind of freaked out when I start talking about it, but if you just come in and try it, it's such a relaxing treatment. And especially if you have like a tight pelvic floor, which a lot of women do. We always get so worried about having like a loose pelvic floor, but most women probably have like a hypertonic, a tight pelvic floor. And so the warmth and the moist heat is so good for just like helping to relax everything. And then that, I was talking about blood flow before, that helps to increase blood flow to the pelvis and the pelvic organs. And so it's just a really nice treatment, relaxing and
nice. How long is that treatment last?
So usually the steam itself, depending on what's going on, this is another thing where it's really important for me to be able to screen you before and like talk about, what kind of is going on for you. But usually the steam itself is about 20 minutes long. So it's not very long, but it has pretty profound effects. And usually what I'll do when women come in is I'll give them kind of like a steam protocol. So, I'll teach them how to do it in my office, and they'll do their first steam in my office. And then they can I make seats which they can, purchase and take home with them, or I'll help them figure out a way to do it in their house. But yeah, so I'll give them a protocol of doing it, a certain amount of time for a certain length, things like that, depending on what's going on for them. So.
Nice. Awesome.
Yeah.
Well, I have loved learning more about what you do and like all that's involved in it. And I'm sure there's so much more to learn. And I just have one more question for you.
There always is.
Yeah. And that is, what's the most superficial thing about you?
Oh my gosh. That's kind of a hard one, but I guess maybe sometimes God, I really like doing like my makeup and looking pretty, I guess. I don't know if that's like a superficial thing, but I know I'm like very like holistic and like natural, but I still love like getting all gussied up and a lot of times. So I don't know.
Nice. Do you make any of your own makeup?
Yeah, actually I do. I try and makeup is another thing that's like kind of riddled with like weird stuff a lot of the time. So where I can do it, like I don't think I could ever make my own like mascara or anything like that. Like that's a little beyond me. But if I can find like natural alternatives or make it myself, I usually will. Yeah.
Awesome. Helen, I have loved this. Thank you so much for coming on today and pursuing all of the technical difficulties on my end. And yeah, I look forward to getting to know you better. And ladies, I'm coming to Helen. I'm going to go start seeing her. And we're going to work on my scarring because I am terrified.
Yes.
This is one of the reasons I want C-sections. I'm terrified of what is going to happen years down the road from all that scarring. So anyway, look for her Wild Moon Massage and Wellness. I think I linked to it in the description of her Facebook page at least. Go check her out. She's located at Root and Sprout in Northborough on Otis Street. So awesome place. They've got lots and lots of fun things there. And yeah, awesome. Thanks so much, Helen. And
thank you so much, Rhiannon.
Yeah.
Sounds good.
Bye, everyone.
Bye.